So once again, my name is Jim Wolgamuth, and Patrick McCann and I have been doing this for over a year. So with that, tonight we have a very special trio who's going to talk about the assault of this current administration on veterans. And, if you assault a veteran, you're going to assault the whole country. So with that, we have Suzanne Gordon, award-winning journalist and author who writes about healthcare delivery and healthcare systems and patient safety and nursing. She is the co-founder of and senior policy analyst at the Veterans Healthcare Policy Institute. She is the author of Wounds of War. Let me see. I just happen to have my copy right here. So, if you want to show me your copy, we'll make sure it gets on the video. So there it is. There's my copy. So she's author of Wounds of War, How the VA Delivers Health, Healing, and Hope to the Nation, to the nation's veterans. Suzanne received the DAV Special Recognition Award for her work covering veterans healthcare. She lives in San Francisco. Then we have Russell B. Lemley. I'm hoping.
That's right, Lenle.
All right. PhD, award-winning senior policy analyst for the Veterans Healthcare Policy Institute. From 1981 to 2019, he worked for the San Francisco VA healthcare system, 26 years as a chief psychologist. He's authored scores of scientific publications and media commentaries on the VA healthcare system, looming existential crisis resulting from explosive outsourcing of veterans healthcare to the private sector. And last but not least, Bruce Carruthers, Army Vietnam veteran and retired VA employee. After 30-year career, Bruce spent half of his career in human resources and the other half in hospital management. He's worked at 10 VA facilities, including VA Central Office. He earned a master's degree in healthcare management while employed by the VA. He serves on the Veterans for Peace Save Our VA National Projects Steering Committee. And timeout. At 75, I do need to breathe. So, and is current president of Veterans Healthcare Policy Institute. Bruce is a member of Common Defense and DAV. He lives in Western North Carolina, receives health care at the VA Medical Center in Asheville, and he is friend of Harvey and I and our radio show. He shows up regularly. So with that, the order I went to, I think we ought to do is ladies first. So Suzanne, then Russell, and Bruce, and then if there's time afterwards, we'll do Q&A. So with that, Suzanne, take it away.
Thank you so much. So I'm really excited to be here and with my dear colleagues, Russell and Bruce, who I work with on a daily basis at Veterans Healthcare Policy Institute. Russell and I co-founded VHPI. What did 6 years ago? I've lost track, however many years ago. And I also serve on the steering committee of SOVA, the Save Our VA Campaign of Veterans for Peace. So I feel very honored. So I want to start by just saying that I hope this discussion will highlight the very positive things that we can do to protect the VA and also protect government and government programs and government employees. I think that while we are assaulted on a daily basis, there's an amazing, and I hope Bruce will talk about that, there's just an amazing blowback to everything that they're doing, which is really very heartening. And I think that we have an opportunity to get our message across, in a way that we never have before. Russell and Bruce and I folks at VHPI and many others on this call have been trying to educate the public about the VA and the Veterans Health Administration, Benefit Administration. We've been trying to educate people about the dangers of privatization. We've been trying to educate the media. We've been trying to educate veterans. We've been trying to educate VSOs. And, it's much more difficult to get people to engage in prevention than it is in taking action when there's a gun at your head. And so that's, I think, what we're seeing now. And so I think our biggest threat is really despair or people feeling like there's nothing that can be done. And it's just so heartening to see all the things that are being done. And just to preface this, and I know, Bruce, again, we'll talk about this, that, there's just hundreds of protests all over the country. They're basically throwing shit at the wall and seeing what sticks. And, the minute they get any blowback, they cancel the cancel, And one of the most heartening things that I was told recently was by Paul Cox, who I don't think is here, but Paul, as you know, is the board member of VHP, and he was the president of VHPI and is now the president of, now the treasurer. And he told me about the fact that he was going to the St. Louis John Cochran VA Medical Center the other day. We could go to visit a sick friend, and he walked into the parking lot, and this older woman was standing there giving out a leaflet to basically protest the firings, the potential firings of 83,000 VA staff and all the stuff that was going on. And it was like, call your congressman and support our unions and support our federal workers. And Paul, who's a long time, activist, and he takes every leaflet, and he went up to her and said, gee, are you someone from Veterans for Peace? Are you someone from the union? Are you someone from, where are you from? And she was just the wife of a patient in the hospital who heard about this, typed up a leaflet, went to the copy shop, and was giving it out. Now that is really extraordinary. And that's happening all over the country. And I get news that people are, vets are coming to protest, and some of them are you, and some of them are people who voted for Trump, and people are really pissed off at what they're doing. And so this is like just a huge opportunity for us, I think, to educate them and to educate them about things that they wouldn't have listened to us if we talked to them about it, last year. So what are those things? I want to read you something that I think kind of says it all. We all know what Trump said when he was president about not understanding why people signed up for military service because they were all suckers and losers. Well, now OPM is sending out things to VA employees. This is an FAQ that they sent out when they were trying to get people to resign, to deferred resignation. And basically they're saying the way to greater American prosperity is encouraging people to move from lower productivity jobs in the public sector to higher productivity jobs in the private sector. So what are they telling VA staff and VA patients and veterans? You are low productivity person, Denny and Bruce, and all you are, taking care of you is just, it's like the lowest of the low. And Amy and people working in homelessness to help vets, and every vet in this call is just a magnet for low productivity. And why would you want to spend your time dealing with these low people when you could be working in the private sector? I mean, what an insult to the veterans of this country. I mean, it's an insult to federal workers in general, but to veterans. And I think those kinds of statements, should be highly publicized. And Doug Collins should be asked, to explain why he thinks caring for veterans is a low productivity activity. And that's what they think. And what we're seeing, I mean, we come into this, and I'm not going to go over what happened, for the past since 2014. I mean, we come into this with a bipartisan consensus in Congress that privatizing the VA stealthily through what we call the salami strategy is kind of the way to go. And that really we should be sending more veterans out to the private sector, and this will give them better care in a more timely fashion, more conveniently located, and of higher quality than that is provided by the VA. And that has been the consensus that has prevailed, sadly, among too many Democrats and definitely among Republicans for the past decade. And it's spanned, the Obama years, the Trump one, and the Biden years. And sadly, Biden continued many Trump policies that weakened the VA as opposed to reversing them, like Mission Act access standards that allow people to go out into the private sector, even though they could get care more in a more timely fashion and even more conveniently located in the VA. Terrible HR policies that crippled VA hiring, failures to hire enough staff, failures to provide needed infrastructure improvements, and so forth. So we come into Trump 1 and Trump 2, and what we've seen is an unprecedented attack on federal employees and federal employment and government agencies and really government itself. And this has seriously impacted veterans. And I think this is what veterans are beginning to understand and what we have to get across to veterans. So, and this is not necessarily in any order, but they started firing probate. First of all, they offered everybody in the federal government and people in VA this deferred resignation. Please leave, please resign. And the union and just sit around for a year or whatever, doing nothing. We'll pay your salary and whatever. And they had hoped, I think, for like 12% of federal employees or something like that to resign, and very few did. So that got abandoned very quickly. The unions and other groups really advised people not to take these take the bait, and very few did. So then they were pretty disappointed, and they decided to fire probationary employees. And so they probably fired about 2,400 probationary employees. And that has decimated many categories of VA workers, clinicians, and so forth. Then they started attacking VA contracts. Collins and company canceled about 875 contracts without that they outsourced VA care to, or VA activities to, without thinking about what the implications were. They canceled the contract with the BU Brain Bank. They canceled the contract for research with the National Centers for PTSD. They canceled suicide prevention contracts. They canceled contracts with workers in Portland, Maine, who are providing radiation monitoring for radiation oncology and imaging. They just, canceled everything. And there's been a lot of pushback, and some of these contracts have been reinstated, and they decided because of the pushback that, we're not going to cancel 875, we're going to cancel 575. Now, what is interesting, I have a list of all of the 875 contracts that was leaked to me. And what's interesting about this is how much work has been contracted out over the decades that could be done in the VA, which I think, is something that we need to think about, because one of the things I think we need to all be doing is, what is our plan for the VA? They're pursuing the wrong plan. What is our plan? And certainly, rather than canceling the contracts and having nobody do the work, a lot of this should be in-house. But the other thing is, if your plan is to privatize the VA, contracting out is how you privatize agency functions. So, they're contradicting their own plan. And a lot of these contractors are people that they love the idea of contracting out, and suddenly their contracts are going to be canceled. So that's an interesting phenomenon. The other thing that they've done is they've canceled the contracts of VA researchers who are on what's called NT, not to exceed contracts, where they're not permanent employees, they're on soft money, and their contracts are renewed usually every 3 years. And they decided to just, on a rolling basis, as these contracts were coming up for termination, not to renew them. So they started in February not renewing contracts of many researchers and planning to continue this in a rolling fashion. And they also halted the program where researchers who are paid by affiliates, like academic affiliates, to work on research projects in collaboration with the VA, that program was going to be halted. We wrote about it, and a lot of people, protested. Patty Murray and other senators, and Mark Takano in the House, and they basically pushed back or pulled back and said, okay, we're going to halt the cancellations for another 90 days. And then they reinstated the without compensation program. Now, obviously, if VA isn't paying researchers to conduct research, how are you saving money? I mean, it's ridiculous. They just don't want research to be done on veterans' issues. The impact on veterans could be staggering, because many of these studies, or much of the research that VA conducts is clinical trials. And to suddenly, if you're, for example, if you have cancer and you're on a clinical trial for a particular cancer medication, and that trial is interrupted because the researchers were fired, or the researchers, or the survey methodologist, or the coordinator, or the whatever. Many of these contracts for research are multi-site. I mean, one for 35 different hospitals or whatever, and you can't just you cannot keep taking a drug if the clinical trial is stopped, and you can't necessarily get care outside the VA or equivalent care, because you can't guarantee that some private sector hospital is conducting the same trial. So and the same is true of all these probationary cancellations, and then particularly will be true since Collins announced that they're going to start firing in August 83,000 VA employees, and bring the current 408,000 workforce down to something like, I think it was 300. I'm sorry, I don't have the figure in front of it. 399 something and change. Which would be like, that's essentially firing like a quarter-ish of your workforce. And then they claim that this won't impact care. Well, really? Who are they going to fire? Are they going to, they claim it's not going to be direct caregivers. Are they going to fire housekeepers who deep clean a hospital room when a patient's had C. diff or MRSA or some terrible hospital-acquired infection? Are they going to fire food service workers? I mean, who are they going to fire that they consider to be non-essential? Their VA doesn't have, I mean, I'm sure there's some managers that maybe in layers of management we don't need, but the VA is understaffed, not overstaffed. And it's been understaffed, and it was understaffed in 2019. VHPI did a survey of VA and VHA and VBA employees in 2019. No, we did it in 2022, and it showed that these staffing levels were insufficient. So this is disastrous. This will have a terrible impact on patient care. To say that it doesn't is ridiculous, is ludicrous. Doug Collins said in his hearing testimony in front of the Senate Committee on Veterans Affairs that VA is not unique, that anyone can give cancer care, anyone can give any kind of care, that a patient is a patient is a patient, and the private sector can do as well in delivering care as the VA. We know that that is not true. Wait times in the private sector are longer than the VA. VA patients are more complex. Russell can talk to you about this ad infinitum, having taken care of many of them, thousands of them over the years. They have many more comorbidities. They have many more mental health problems. They have all kinds of military-related issues that doctors in the private sector are unable to recognize. And also the idea that you can take care of more, veterans with fewer employees, given the PACT Act that was just passed, where you're going to see a huge influx, and already seeing a huge influx of veterans, coming in because of toxic exposures. This is like ludicrous. Colin says the VA isn't unique. Let me just conclude by telling you one little unique thing about the VA that's fascinating. Telehealth. We've been fighting to have telehealth included as access to care in the VA for many years at BHPI, since they excluded telehealth in the Mission Act eligibility standards. Well, it turns out, we live in an era of telehealth, right? And people are talking to their shrinks on video. I talk to my primary care provider, etc. Well, in the VA, in 2018, they made a rule called Anywhere to Anywhere, which was bolstered in 2020, that allows any VA provider anywhere to take care of any VA patient anywhere via telehealth. So when you have a patient who needs a nephrology consult in Alaska or Wyoming or Guam or Hawaii, where there are very few nephrologists, that patient can sit in Fairbanks or wherever and talk to a nephrologist in Chicago through this Anywhere to Anywhere program. If a patient needs a mental health appointment and there aren't enough mental health appointments available in San Francisco, that patient can talk to a clinician in Boston who is available. That is not true in the private sector. In the private sector, in order to take care of a patient out of state, you have to be licensed in the state you're in and in the state where the patient's in. So how many psychologists or nephrologists or primary care docs or whatever are licensed both in San Francisco and New York State or Tennessee or Kentucky or whatever? So you are depriving people of an enormous resource. And this is true in every VA program, many VA programs. We haven't even discussed the teaching mission of the VA that is critical. We've talked a little about the research mission, but we also haven't talked about the emergency preparedness and memorandum of agreement of understanding that the VA has with the DoD, which we can talk about in question and answer. But I think that veterans are suddenly getting it, and the media is getting it. We've never had as many media requests about these issues or as much media coverage of the VA. And I think that our job is to keep these protests going, to educate people about what's happening, to never ever say, we told you so, we tried to warn you, if you voted for Trump, this is what would happen. It's a bad idea to say that, even though you can feel it. And to really say, we know you didn't want this. He promised he wouldn't close the VA. He promised he wouldn't attack Medicare. He promised he wouldn't attack Medicaid. He promised he wouldn't attack Social Security. He said he hadn't even read Project 2025 and barely knew what it was. What is that, Project 2025? And so I think we need to be out there at these protests, leading these protests, talking to the media, talking to veterans who voted for Trump, and saying to them that every time you push back on the bully in the playground, they collapse. And that is exactly what they're doing. Every time we push back, they say, oops, we didn't mean it, And so we just have to keep pushing back and helping others push back. It's very exciting that Common Defense has just joined and initiated a campaign of its own. Hopefully more VSOs will do this. The VFW and PVA have been very good. DAV has not been that great. And I would suggest that anybody who is a disabled vet and who doesn't belong to DAV should immediately join and put pressure on them to be a little bit more outspoken about this, and should be, if you are a VFW member or a PVA member, or know that, compliment VFW and PVA, give them shout outs for the very strong stances they have been taking. So in conclusion, I'm very sad about this assault on American institutions, but very heartened by the fact that, veterans are chaining themselves to the White House fence, and, veterans are coming and showing up at these meetings and protests, and that people are making little leaflets all by themselves without ever having heard of Veterans for Peace. It's really very wonderful. And we just have to figure out how we can take advantage of it and, ride the wave effectively that we have helped to launch. That may be a mixed metaphor, but whatever. So thank you so much for having me speak. I hope I haven't gone on too long. And I obviously would be glad to answer any questions in the question and answer period.
Thank you so much, Suzanne. All right, Russell.
Thank you. And I'm delighted to have this opportunity to be on the Zoom. And that was great, Suzanne. Before I even get into any content, I just want to put out a request, which is that we are looking for veterans who have had questionable experiences in community substance use residential care. So if you yourself or someone who's had a very questionable experience of any sort, and you can contact me. I put my email kind of earlier in the Zoom. You can do it through the hosts as well, who know how to reach me. But we're just looking for individuals, and then we can take it from there in terms of how that might be useful. And I'll say a little bit more about why that is going to be useful in a second. But just I want to start with that request. The other thing I think is worth saying, that's a through line for Suzanne, for Bruce, for myself, for our organization, is that we fundamentally believe that if community care is unchecked in terms of the amount of care that is farmed out to community care and the dollars that travel with it, that at some point it is going to kind of bleed out the possibility that the VA can exist in its current form. And so one of the values that I think we all share is that we think that the VA is an institution, a system, really, that has plenty of blemishes and flaws, but it's really irreplaceable. And that when it's gone, there will be nothing, it won't come back, and what will replace it won't really be in any measure kind of what the VA has been and could be if we protect it. And so I think a lot of what we say and do has that as a premise. And some of my comments in a moment when I'm going to talk about Congress really come from that. There are two reasons that that's come up as an issue at this point. One obviously is the kind of dramatic assault that Suzanne was just alluding to. But when the Choice Act passed in 2014 and then the mission in 2018, a lot of people were lulled into believing that you could have your cake and eat it too. And they were deliberately lulled into it because it was extra money that Congress kept forking over right from the get-go, right from the Choice Act itself, that gave the pretense that the VA could be fully staffed and fully resourced, and you could also have the community care to your heart's content, and there was actually no competition for resources between the two. And that went on for a number of years, and I think one of the reasons that people were slow to have any reaction to community care is it looked initially like there was no downside to it. This was just an added bonus. What we started writing about actually in 2016, and then have, now that we're in our ninth year doing, is saying that eventually has to stop. And actually it did stop about a year ago, when all of a sudden now we're seeing many policymakers, both proposing bills, but many other advocates outside of actual congressional legislation, we're saying that community care should be paid for out of the VA's pocket rather than in addition to the VA's pocket. It would be out of the pocket, and that this then will lead to some tipping point that if we're not over it yet, we're certainly at a tipping point where there's a kind of downward spiral, that money that comes out of the VA and into the community ultimately reduces resources, ultimately reduces programs, personnel, units, and so forth. And there's very little justification for maintaining the system as it exists. I think at a core level, kind of a lot of what we endeavor to do in our organization is to see that never happens. And I think we will continue that fight to the bitter end. I think Project 2025, which we're only beginning to see more of taking shape now, has that process in its mind. A core piece of what's in Project 2025 says that resources ought to go into VA community-based outpatient clinics, that should be taken out of medical centers, inpatient units, emergency rooms, that the funding there should shift it first internally in the VA and ultimately out into the community care program. And I think that one of the things we have to be careful about is that within this administration that we see more money going out to the community that ultimately leads to decisions that certain VAs are not worth saving. At this point, they all still exist, all 170 medical centers. And it's important to protect that for many reasons that we may not even get into here, but maybe we'll in the question and answer later. I just also want to make one other additional comment from what Suzanne was saying about how can you fire 83,000 employees and still maintain the same health benefits. I think if you read between the lines, I think what is meant by that is all veterans who are eligible for care and health care will get them. But I think what is meant is, but you won't get them at the VA. That is kind of the unspoken piece about why you can continue to get all your benefits, because it's not promised at the VA anymore. And I think that is what is meant. Obviously nothing's been revealed yet about where those 83,000 are, but actually pay attention to what Secretary Collins is saying at different places, that he's giving interviews because he's beginning to demonstrate where he thinks there's so-called fraud, waste, and abuse, which will, at least it will be claimed that that is, those are the programs and those are the personnel that he can see where there could be cuts. My task actually today, I don't think anyone except Bruce and Suzanne and I had this agenda, was just to talk about what's happening in Congress. So I'm going to kind of pivot here. Um, but I just want to say one other thing also in keeping with Suzanne saying, which is that the resistance to what has happened in the first couple of months in the new administration, the tip of the spear has been about veterans employment and veterans benefits. And so that really dovetails with kind of what we've been doing for the last 8.5 years. But Suzanne was talking about, the number of requests for interviews, the number of articles that are appearing, and so forth and so on, is that the resistance is with this issue, which I think gives everybody on this call and all your compatriots a lot more potential power, if we keep this on the front page. And like Suzanne was saying, is that I think proactivity at this point is likely to have continued success. And that has to do with demonstrations, it has to do with news articles, and I'm going to talk a little bit about Congress here. There's one particular bill that we are extremely worried about. It's the Veterans Access Act. Sadly, it has been endorsed by most major veteran service organizations. We don't have to get into kind of how that happened necessarily here, but just, other than to say that makes it have more potential in Congress to feel like it's got veteran support and therefore to get smooth sailing later. But the Veterans Access Act, if you drill down, has one particular buried component to it in Section 302, if you want to look, which proposes a pilot in which veterans would no longer need VA's permission or authorization or referral for mental health care and substance use disorder care in the community for outpatient care. This is something that, in spite of how difficult the Mission Act has been for kind of undermining the VA, the one thing the Mission Act said and did is the VA would still always remain the authorizer of care. And the system is actually built on that one premise. There's a pilot in the Access Act that says we're going to start with at least 5 sections of the country, and we're going to start with a mental health and substance use disorder, and we're going to start for 3 years as a so-called pilot. And then after 3 years, the VA is instructed to figure out what are the impediments to making it kind of completely universal for all healthcare conditions across the entire country. And if and when that happens, that's the ball game, because that is essentially the same as issuing insurance cards to veterans to go get your own care, and the VA's only involvement at that point is paying the bill. It completely upends the entire model on which everything good in the VA that is good is predicated. And so we've been very strongly opposed to that section of the bill. If it's not modified, then the whole bill itself. But it is a Trojan horse easily in terms of the way it's constructed. At this point in time, both the House and the Senate Veterans Affairs Committees have had initial hearings on the bill, and neither have gone to markup. In both the Senate and the House, they are waiting for a CBO score on the Access Act before they do any more. If there's one thing that I would make requests of those of you on the call, if you haven't already done so, to please write your members of Congress and indicate the concern that you have that this pilot actually would quickly bleed out the VA and really upend it in terms of what if you favor the VA, you can't actually favor this pilot. There should be no pretense that a pilot is only a pilot and people use data from the pilot to actually make improvements, and if it's failing, that they actually abolish it. There's no evidence that Congress does that. If you go back even to the Choice Act, the Choice Act not only was a pilot, it was a sunset legislation that, as was written, was supposed to catch up on everybody who was on wait lists within 3 years and extra resources, and then it was supposed to sunset and go out of business. Within a month after it passed, John McCain, who was one of the authors of it, said, if I said sunset, I actually meant permanent. And that was probably true. That there's no reason to think that pilots really do sunset. They actually are just the foot in the door for something that's permanent. So my emphasis about what's happening, that's at the kind of red alert in terms of what's happening in Congress. There's a couple other pieces of that legislation that should be of concern. One is the way in which it gives veteran preference now as a new criteria for eligibility for community care. We're really not a fan of that because that's a very slow bleed, but it's nowhere near kind of as rapid as the piece that I was talking about just a couple minutes ago. There's one other section in that bill that I'll just mention, which has to do with new ways of monitoring residential rehabilitation treatment programs in the community for mental health and substance use. There's an opportunity in that section of the bill, if Congress had the guts, to have the same criteria for the ways in which quality control happens in the VA to be applied outside. In spite of the fact that the Mission Act talked about quality, I counted them 50 times. It's a bill that supposedly had to do with quality in the community and access to the community. You know, in the 6 years since the Mission Act has been in play, it's been access all the time, and actually deliberately, until very recently, not a single mention of any quality measures that are expected from community care. So not only do you kind of have more veterans being farmed out, but you have a system in which no quality measures are being applied for that care. And community care is going to be around forever. You know, no matter what happens in terms of legislation, that's not going away. So one of the things that we have to do is to put pressure on Congress to have quality standards be applied, and ideally the same quality standards that are applied to the VA be applied to the community. So that would be another ask as well. So lastly, I just want to say that members of Congress, they are responsive to contact. Do it often, and do it again. And with that, Bruce, I'll turn it over to you.
Thanks, Russell. Before I talk about the Silva campaign, I want to make a few quick remarks. Just to add to what Russell said about quality. Today, VA Secretary Collins was at the Asheville VA. It wasn't a town hall. He only invited the press. But he made a couple comments. He said, whether care is provided at a VA facility or in the private sector, it's VA care. And I think Russell and Suzanne made clear that's not the case. But he also made the false statement that we make sure that care that veterans receive in the community is the same as they receive at the VA. There are no quality checks on care that's provided in the community. No inspections. We recently had, I wrote a letter that'll be published soon. The Inspector General did over 120 reviews in 2024 of VA facilities, and they were all focused on either quality of care, timeliness of care, or financial management. The Deputy IG Inspector appeared before, I think, the House Veterans Affairs Committee, and with some pride said, well, it was either 20 or 21 reviews at the community care. But in fact, those reviews were almost exclusively about how the VA might have failed to manage the community care program. For example, community care doctors didn't submit medical documentation, and the VA was faulted for not following up multiple times to get that care. So there was another section there that showed in the 12 months, I think from about September of 2024, 12 months before that, only 2 reviews were done of quality in the community care program. So the VA has no idea, no sense of what sort of quality of care is being provided to veterans in the community care program. It's just kind of a belief that the care in the community is equal to or better than the VA, when in fact multiple studies show that the opposite is true. It's not only that when a veteran gets referred to the private sector, they enter a very fragmented system. And before I had a service connection high enough to entitle me to complete care from the VA, I had a lot of care in the private sector. And I've had a lot of medical issues over the last 11 years. And I can tell you that the VA system is completely different than the private system, where your primary care doctor refers you to a specialist. That information doesn't get back to the primary care doctor. You see another specialist. There's no coordination between those two specialists, no review of your medication list. And in the VA, that all happens, especially when there's a medical record that has everything in it and every provider can review. And I'm sure a lot of you know that, but if you don't, it's certainly something to think about. If you look on VHPI's website, you can see a list of studies that have been done that show the quality of VA care compared to private sector care. I want to talk a little bit about the Save Our VA project. It has been around for a long time. The current iteration is about 5 years old. That started in 2020 at a meeting in a conference in DC that where we did a lobbying effort and formed the VA steering committee. And there are a number of people on it. Currently, the primary people who do work for the Save Our VA campaign are Jeff Roy, me, and Arliss Herm. And of course, Suzanne is on that, and she does a lot of work both for SOVA and for VHPI. I mean, she and Russell write an incredible number of articles. They write statements for the record for Congress. Russell often travels to Washington to testify. But the kind of things that we do in the Save Our VA campaign is a number of things. We have tried to establish contact with members of Congress, primarily the staffers of these members who have who work on Veterans Affairs, and particularly those who are on the House and the Senate Veterans Affairs Committee. We frequently send them emails or contact them about issues that are of importance. For example, the Access Act. We'll write to them, excuse me, write to them about that and try to have a dialogue with them. We are going to Washington again at the end of April, first part of May, and Jeff Roy is now setting up meetings with members of the Senate and the House Veterans Affairs Committee so we can meet with mostly their staffers. Only a few of the Congress people have met with us. Last time, Takano did, actually met with me and talked with me for about 25 minutes. And usually all you get with anybody is about 20 minutes, so I was quite impressed. We have conducted a number of training sessions. Suzanne and I did a number some years ago of VFP chapters all across the country to talk about Save Our VA. We recently did a Zoom call with the Seattle chapter. Tomorrow night, I'm going to talk to the North Carolina chapter of Common Defense, and we're doing this tonight. We also, one of the primary things we do is we publish the tri-weekly update, and that covers primary issues, often lists articles that are published by Suzanne and Russell, other people in VHPI, or other articles that we found. But in each one, almost in each one, we produce what's called a call to action, and that's actually a letter to your congressional staff. I think the next one that's going to come out is on the Access Act. And it's a very easy thing to do. So if you go on, and I post at the Save Our VA website, and actually all you have to do is just put Save Our VA into any search engine, click on it, it will take you right to the website, and you can look on the right-hand side, it'll say calls to action. And so if you go to that and you look at the letter and you agree with it, all you have to do is put in your name and some other contact information. It will automatically be sent to the appropriate people. So if you live in North Carolina and the district I live in, for example, it will go to Chuck Edwards, who's my representative, and then the Senators Budd and Senator Tillis. You don't have to do anything other than fill that out and the letter is sent. We do ask that everybody just take a minute in the beginning to write something about themselves, as simple as, I'm a veteran. Or what I usually write is, I'm a Vietnam veteran and I received my health care services at the VA Asheville. Something like that personalizes a letter, and we've been told that research shows that congressional staff pay a lot more attention to a letter that has some personal information in it than a letter that doesn't. And it only takes a minute to add that. The whole process won't take any more than 2 or 3 minutes to send the letter. We have 1,000 people signed up for our updates, but we're lucky to get 250 letters. If we could get a lot more people, if 1,000 people would sign those letters, it would have a much bigger effect than if only the 200 or 250 people signed the letters. So I encourage everybody and everybody you know to have them look at these letters, to read them. If they agree with the content of that, to send the letter. It doesn't take long. The whole reading the letter and sending it would take you 10 minutes at the most. It's a simple thing to do, but it's an effective way to contact Congress. So those are the kind of things that we do. We're a small group and we work pretty hard. We've been at this for about 5 years. We've been trying, along with VHPI, to make alliances with other groups. We've had conversations with people in AFGE, the American Federation of Government Employees, the National Federation of Federal Employees, to try to work with other groups. And I think Suzanne mentioned that we've had contacts with Common Defense. Also, Vote Vets has started a program to help defend the VA. And what seems to be happening now, and I think Suzanne tried to make this point, is that there's a groundswell of opposition to what's happening to the VA, and it's a little bit late. I hope it's not a day late and a dollar short, because we've been trying for a long time to alert people to the danger to the VA, but now people are actually seeing it. I think a lot of people thought, in fact, VHPI did some social media stuff, and a lot of veterans who were apparently Trump supporters thought that Trump would never do this to them. Their response to our warning about what could happen to the VA was, well, but that'll never happen. I think now many of them are starting to see that, in fact, it is happening. And like Suzanne said, the point is not to say to them, Trump's a bad guy, or I don't like Trump, or I told you this was going to happen, that see what you did by voting for him. The point is to say, what's going on here is bad for veterans, and we need your assistance without engaging them on potentially on other sorts of issues, because the point for trying to save the VA is to get veterans and the veteran community and the friends of veterans mobilized to tell Congress, particularly, that what's going on here is not right, is not fair to veterans. I've always tried to make to the point to people that if we're going to have 600 or 700 bases overseas and we're going to constantly send people into harm's way, and during Iraq and Afghanistan, people were getting 3, 4, 5, 6 tours of duty in combat zones. If you're going to do that to people, you can't balance the budget on the back of veterans. You can't say, well, now we're not going to take care of these veterans. And if people say it's expensive, my response is that's the cost of having a huge military industrial complex and being involved in so many conflicts around the world. If you don't want to spend so much money on veterans care, don't have the kind of military we have and don't become involved in so many conflicts. But as long as they're going to do that, those who answer the call to duty have to be taken care of afterwards. Veterans are not toy soldiers. They're not to be thrown away when you're finished with them. They're to be taken care of when they have problems. And I want to make one more point about this Project 2025 that a lot of people may not realize, and that is a real threat. Part of what the people who've written Project 2025 and people involved in this believe is that the only service connection that veterans should get should come from some kind of physical wound. You're injured in combat, somehow in the service, you hurt your back, and that can actually be physically shown. The other sorts of things that people get service connection for, PTSD, exposure to Agent Orange, cancers that come from Agent Orange, prostate cancer, cardiac conditions, all the things that will come from burn pit exposure, traumatic brain injuries. Unless you can show an absolute direct connection between what happened in the service to you and the condition you have, you should not be entitled to service connection. Now, maybe that'd be prospective, but maybe not. I wouldn't be surprised if we start seeing people who have things like PTSD or suffering from military sexual trauma, start having those things reviewed and having their service connections revoked or lowered, because that's essential thrust behind this. It's not only to privatize the VA healthcare system, but to reduce the number of people who are eligible for service connection. And your eligibility for service connection has a big influence on whether you're eligible for VA care or not, and whether you have to make copays or not, or whether you get complete coverage. So it's a threat not just to VA healthcare, it's a threat to this whole system that has been developed to take care of veterans. And one last point. So I worked for the VA for 30 years. When I started working for the VA, the criticisms that the VA faced were warranted. It was not a first-class healthcare system. Starting in the 80s, and starting particularly with Undersecretary of Health Ken Kaiser, the VA underwent an incredible transformation from not being a top quality healthcare system to being the best healthcare system in this country. And that has happened, and that needs to be maintained. And if Trump and his lickspittles are successful in this, it won't be anymore. It'll be an insurance agency paying for bills. And what I fear is that what will happen is it'll first pay for everything, then it'll be like Medicare, where there are co-pays. Finally, it'll be like Medicaid, where it pays so little that the only providers who take you as a patient are those who are really at the low end of the scale. Now, a lot of people say that might happen, but who would have believed the kind of things that are occurring in just the last 2 months of this presidency? So I would say nothing is impossible. I put in the address to the website for Save Our VA. I really encourage you to look at it. And I also encourage you to look at the Veterans Healthcare Policy Institute, which is the best source for information on what's going on in the VA right now and issues that you should be concerned about. So we have some time left, and I'll stop now so we can have a question and answer period. But I appreciate everybody's attention. I really appreciate the opportunity to talk to everybody.
Well, thanks so much. And what a great 3 presentations. This was truly important. Now, if you want to ask a question, you go down to your reactions icon. All right. And you raise your hand. I'm going to do it right now. Oh, there's already one. And so I'm going to be second. Doggone. So, of course, Dave Cooley got out in front of me. So, if you have a question, just go down to reactions and click on that, and then click on raise hand. And remember, if you want a copy of this presentation, of this Zoom, make sure your email is in the chat. And there's been a couple of really great comments in the chat. I will be sending that out to everybody also. So with that, Dave Cooley has the first question.
Good evening. My first question is actually not a question. It's a suggestion of something that one can do. In the chat, I put a PDF file that has a list of all the House and Senate Veteran Affairs Committee members' phone number contacts. And what I will tell you is, you do what Bruce was saying earlier with regard to a letter. You say, you call Senator so-and-so or Representative so-and-so, and you're going to be speaking to staff. But you're going to start off with saying, I'm a veteran. I realize I'm not in the representative district or in the senator state, but nevertheless, Senator so-and-so represents me, or Representative so-and-so represents me because they are on the Veterans Affairs Committee and they represent all of us veterans. And I can tell you that it can work very well. I have, back when he was in office yet, contacted Senator Tester's office, and I actually got an email back from his attorney, and he wanted to set up an opportunity to speak with me directly on the telephone, the attorney for the Senate Veteran Affairs Committee. So we did set that up. So I want to tell you that you can reach out beyond just your state senators and your representative, but to the Veteran Affairs Committee's members. And that's a good place for you to put in your 2 cents worth about Section 302 of the Access Act. That that's going to be a bad thing for the VA and our care in future. Thank you very much. Appreciate it.
Thanks, David. All right, Jim Wolgemuth, here's my question to all three of the panelists. I know I go to the VA in Nashville, and they work side by side with Vanderbilt. And if the administration, abuses the VA to the extent that it shuts down, well, I guess get to the question, Jim. All right, are any of these university presidents or researchers standing up and saying, listen, you can't do this to the VA because we help train our doctors. When I had surgery, I had two or three VA doctors and 3 people looking on who were just medical students at Vanderbilt. I mean, if the VA goes away, doesn't that hurt colleges and universities? And are they stepping up? Are they trying to do anything? So, whoever wants to take that on.
Well, I can say a little bit about it, Jim. The VA has affiliations with virtually every medical school in the country, and then with all kinds of other institutions that provide healthcare training. And the Association of American Medical Colleges, name of it, did write a letter to Congress saying that if the VA was done away with it, it'd have a severe impact on medical education. 70% of all doctors receive at least some of their training in a VA facility. And I worked at a couple of highly affiliated institutions, 3 of them, the Birmingham Hospital, the Lexington Hospital, and the Denver Hospital. And so many physicians have joint appointments. They work both at the VA and they work at the medical school. And so there's an interchange of patients there, and patients are sometimes, if at the VA, they'll be taken over to the medical school for some treatment, or the surgeons come back and forth. So the VA benefits greatly from that, as do the medical schools, but also as does the American public. I mean, if the VA went away, the training it provides for doctors, for nurses, for physical therapists, for occupational therapists, for all these people in the various healthcare professions, I don't know how that would be filled. And I think they're concerned about that. I don't know if they're doing enough about it, but it certainly is meaningful to them. It has strengthened the VA to have these affiliations. It has strengthened the U.S. healthcare system, and it has benefited the general public. One other point quickly, that these research things, Suzanne mentioned this without compensation appointments. Well, there are research programs that are funded by the VA or funded by other people, and there's sometimes joint research programs between university personnel and VA personnel. These without compensation appointments are people who are interested in doing the research, don't need to be paid for it, but they work on the projects, and it doesn't cost the VA anything. And initially, the VA canceled these. I mean, the VA research program is second only to the National Institutes of Health in its breadth and its scope, and it benefits everybody. It's not research on prosthetics, research on any condition that affects veterans, affects the general population. So that will also be lost if we do away with the research program. Suzanne or Russell might have something to say
Yeah,
about
let me
this.
just jump in briefly. So, Jim, I think one of your questions is how active are the medical schools? And Bruce was just mentioning the AAMC. From my perspective, AAMC has been lukewarm at best in terms of what they ought to be doing. And I don't know if anybody on this call has direct or indirect contact with them, but any way in which they can leverage their power around this, we ought to encourage that. You know, in my own contacts with them around the Access Act, which would be catastrophic for them, they just didn't. They have not weighed in on the Access Act, and they basically punted. So I think we'd love to have kind of more of their concern when there are privatization bills that are going to be harmful to VAs. I think your question, Jim, also suggests what happens when a unit is closed down. You know, which when that happens, there's going to be no training on those units, and ultimately, um, what will disappear are some of the stipends that the VA pays in order to have training happening on those units. And this is going to eventually have kind of a pretty serious impact on many of the medical schools that Bruce was talking about in terms of reduced funding for training. I mean, that is going to be a long-term consequence of privatization of the VA and the closure of units and of hospitals.
All right. Thanks. Suzanne, you anything to weigh in, or should we go to the next question? Oh, you're muted.
I don't have anything to add to this. I mean, I think that the universities are, not, they should be weighing in more on the cuts to funding. And, I think that people are just too scared, and they should be less scared and should get their acts together and start speaking up. But I just want to make a comment that is kind of off this point, but we really need stories and people to talk to the media and talk to ourselves. And like Ted Engelman, um, I need you to talk to me, and I need you to talk to the media, and I need your email and your phone number, because if anybody who these cuts are impacting really needs to speak up, because people are asking us. I mean, I spend hours, Russell spends hours, Bruce spends hours talking to the media, and Bruce is a veteran, so he can talk about it, but Russell and I can't, because we're not governed by the VA, and they want to talk to veterans. So, Ted, if you would be willing to do that, that would be super. And I'm going to write it down if you give me your email and your phone number. And if I can send people to you, and anybody else who has had a bad experience or has delays or anything, please be in contact with me and Russell, Bruce. You have our emails. Please memorize them, and tell this to your friends as well, and be on the lookout for this, because this is, again, how we're going to stop it.
All right. Thank you. Ken Dursa, unmute and ask your question.
Yes, my name's Ken Dursa. I'm a member of the newly formed labor working group of VFP, and I heard mention that you folks had worked with the American Federation of Government Employees about some of the reductions, and we've seen in checking out the postal workers website, they have what they call the home front, and the VA is a top concern. It has a red alert as their banner for the home front, and they have by the way, their labor history is incredible, and we just got a story up there for the last International Women's Day, and we robbed it from the postal workers, which is good stuff, and we'll get them on May Day. The question is this, and all the other major unions, because who fights the wars? The working people. And who is in the unions but the working people, and a higher percentage of veterans than in other organizations. So how can we get something together, the synergy? And I'm sure they don't have a lot of staffing at some of the unions, and especially now that they're being the layoffs, there may even be staff reductions from the union staff. But how can we develop a synergy? Or these people already set up a committee with VFP to do the outreach and communication with the major unions, United Auto Workers, United Electrical Workers, etc. How can we develop that synergy? I don't have the expertise, but I'm sure that the major unions do.
Well, I think I can take that question, maybe Bruce or Russell. We've been working with the AFGE. It's not the most militant union on the face of the earth, but it's getting better. NEFI, there's some fabulous people in NEFI, National Federation of Federal Employees, and you should look up the FUN, Federal Unionist Network, which they've set up. And so, the one union that I haven't heard enough of is from the National Nurses United, and they don't seem to be able to work with anybody. But there is coordination suddenly with these unions. I wish we had more contact with the postal workers. The International Association of Machinists has a lot of veterans, and they have a veterans group. So, I think that probably for you all, the most productive thing is to just contact locals in your area. Sometimes AFG and NEFI nationally don't have enough contact with folks locally. So you can reach out to, find out what the local is in your area. You can reach out to the state feds, the AFL-CIO, and I'm going to go ask my husband, who spent 27 years working for CWA. In a second, I'll run out and ask him. But, I would suggest very much reaching out to your local groups, because sometimes there's a disconnect between national unions and their, and the locals. And the locals are really where the action is, and you can find out where there are demonstrations, and just keep your eye out, and also check out the FUN, FUN, Federal Unionist Network website, and they'll let you know. I would also contact local healthcare reform groups, because they're very involved, should be more involved in this. They're very willing to be involved in it. And the same folks that are trying to kill Medicare and Medicaid are trying to kill the VA. And, the whole point here, I think, is that they want to get money for their tax cuts, and they can't fund, federal services and their tax cuts, right? It's just like not possible. And so that's why they're doing all this, aside from their just animus and meanness and, whatever. But I think that let me just go and ask my husband for some more suggestions, and you can, I know people have more questions.
All right. Well, while we're waiting on Suzanne to get back, Joe?
Yes, what I have is basically a comment. I work in hospitals in my working career as a union worker, and I'm also, of course, a veteran, and I'm in the Providence VA system. I have 8 appointments in the next 30 days, but in one of the hospitals that I worked in, it was a respiratory care facility that was basically financed by the tobacco industry, and their whole focus was to get as much Medicare money as they could from the patients. So you could see that's kind of a connection with the finances behind healthcare.
Yep. All right. Thank you.
Oh, you're welcome.
Thank you. All right. Any comments from Russell or Bruce with regard to Joe's comment, or should we go on to Doug Rollins?
Yeah, can I just make a
Yeah.
quick comment? So one of the things I didn't mention, though, is what we always look for. If you have, particularly if you have a member of the House Veterans Affairs Committee as your representative, you're in that person's district, or if you live in a state where a senator is a member of the Senate Veterans Affairs Committee, we're always looking for a veteran who will join us in a Zoom call with these representatives, particularly if you've gotten care from the VA and you've had a good experience, or if you've gotten care from the community and not had a good experience. if we can get a veteran with us and we can arrange a Zoom call and we can talk, probably one of the staffers, and you can tell your story, and that can be pretty effective. But we usually need a person from the district or the state to be able to have a Zoom call. So if you're interested in that, you can contact us, and I'll put my email in the chat, and I think Jeff Roy is on. If he is, he'll put his in there too. So you could let us know, and we can talk to you about trying to arrange a Zoom call. That's all I had to say. Thanks.
All right. Thanks,
Um,
Bruce. All right. Oh,
I'm back.
Suzanne's back.
Um, you should all go to the Federal Unionist Network. And you can there's a thing that says join us, and you can sign up to be get emails, and you can also, they have a thing that says events. The postal workers will be holding a lot of events and protests, and you can keep your eyes posted for those, and you can join them. That's a great way to make a contact, to show up at people's protests. And also, you should reach out to the local AFL-CIO, your local labor councils, as well as the state feds. Those are just a couple of things that, ways to do this.
Thanks, Suzanne. Thanks, Suzanne. And remember, everybody, I'm going to send out, if you put your email in the chat, I will send you a copy of this recording and a copy of the chat. So you'll be able to get all the great comments too. Doug Rawlings.
Yeah, thanks, Jim. One quick question and one suggested strategy, perhaps. The quick question is this: does anybody know if the VA is giving the concept of moral injury any serious consideration? It's a much more comprehensive idea, I think, than, say, PTSD or something like that. So I think that's worthy of looking at. The suggestion is that what we did in Veterans for Peace, when we found out that the Pentagon was trying to write a history of the Vietnam War, we put together a full disclosure program to sort of counter that. And part of that was asking anybody who was directly impacted by the Vietnam War, to write a letter to the wall, which we delivered on Memorial Day. We delivered over 500 letters. And I thought maybe it would be an interesting idea to have people write a letter, anybody who's directly impacted by what's happening at the VA, and on Veterans Day, go to the VA in Washington, D.C. and deliver thousands of letters in print, in envelopes. Anyways, just that idea and the moral injury concept.
And Doug, the short answer to your question is yes. Surprisingly, actually, the VA has been putting money into studying it for probably 15 years. The two VAs that are doing the most work out of the Boston VA and the San Francisco VA. If you Googled moral injury in veterans, you'll find many studies and treatment protocols. And I actually think some of the people on this call have been through some of the protocols that the VA's developed, to their credit.
Thank you. And the book by Allison Staunton Lind, I think, is a very good resource as well on moral injury. So.
Very good. All right, Margaret Peoples. Unmute, Margaret.
Trying. Can you hear me now?
Yes.
Okay. I live in Charlotte. My husband started a chapter of Veterans for Peace when we lived in Raleigh. And that's still going, the Eisenhower chapter. And I think Vicki Ryder is pretty active in near Chapel Hill, keeping that going. I saw you were having this tonight, so I wanted to listen in. Our daughter works here in Charlotte as a remote worker for the CDC. So we all think she's going to be moved some other place, but she doesn't want to go back to Atlanta. They've lived there before. And she likes Charlotte a whole lot better, but her husband's job here is kind of tied in. One thing I was wondering about, we lived in Arizona for many years when the children were very small, and we went to a lot of native land, the Hopis and the Navajos. And of course, when we lived in Oklahoma, we had lots of Cherokee land around us, even though it wasn't consolidated like a reservation, it was still Cherokee land. They're the Western tribe, obviously, who had to be forced out of North Carolina. But anyway, do they have veterans on the reservations, on the tribal lands that contact you guys?
Interesting question.
I think they do. I mean, isn't that true? I mean, a lot of Native Americans are veterans. I mean, I'm not an expert on this, although I know that Paul Sullivan, who is part of our steering committee, is an expert on this. But I can't speak to it. But yes, there are many veterans who are on Indian lands. And of
I
course,
would
I
think
don't know what
they have very serious issues that make them not just veterans, but Indigenous people with poverty and mental issues. They need a lot of help. And, you know, but Indian Health Service is there, but I wonder how much help they get as a veteran when they go to Indian Health Service on their own lands. I don't know, but if you think things are bad somewhere in our country, Indigenous land is always where it's been the worst.
Yep.
And I've lived there, you know, for several years now, and I've seen it. It's rough.
Thanks, Margaret. All right, we've got some minutes left, and we've got 2 hands up, and we'll be fine. All right, the next question is from iPhone Karen. Karen, try and ask your question.
you need to unmute if you can.
Okay, well, she disappeared, so we'll go to Arla and John. Unmute, please.
Yes, hi, John Wilkes and Arla Ertz, Albuquerque. Question, does this group, organization, etc., do you have a canned op-ed or letter to the editor which describes all of the benefit of the VA to non-veterans? The 300 trials going on with NIH, the training facility for interns and fellows, the strategic reserve for the public health service. It's my view that the public needs to know that if the VA is basically demolished, a real asset to the country is lost, not just veteran health care. Do we have such a document?
We have, if you go to our website, John, which I put up there, if you go to the website and you look up our work, I think there's a thing that says why the VA matters, and we have a series of fact sheets of topics we cover. It's under topics we cover, why the VA matters. I can put that in the chat, and there's a number of
Please.
fact sheets that will help you with that. And I'm trying to, I don't know, I'm stuck with this send chat to, hold on, meeting group chat, send chat to meeting group. And again, I know Veterans for Peace, Bruce could, has a number of things. We don't have a single op-ed right now on that issue, but, if you contact us, we can help with that probably, but it would be a very long op-ed. One of the other things we didn't talk about, Amy Fairweather's on the phone, but is the impact on homelessness programs and homelessness nationally. I mean, if you look at, and Amy, maybe you should speak about this, but, if they disappear the VA, veteran homelessness will skyrocket, I think it's safe to say, and that means homelessness in your area will increase. Amy, do you want to say something or not?
Okay, thanks for that very much.
Yep.
Amy?
Okay. Denny Riley, unmute, please.
Sure. So I was at some of the early meetings with Russell and Suzanne when they were decided they were going to be troublemakers. And so since then, I go to the VA a lot. And every time I have talked about the fact that this institution is going to be closed down if people don't do something about it. Everybody, volunteers all the way up to surgeons. And everybody was going, nobody took it. And sometimes they give me they give me Trump raps and stuff. At any rate, the thing about they would, and then a week after the election, I went over there. Some of those people were so sulky. I mean, because they realized what an error. But you don't say anything about it. The thing about Native Americans is that a bunch of us went up to North Dakota to stand with them against the pipeline. And I was talking to some young men on the reservation are not don't have great opportunity, but they were raised in a warrior culture, and so joining the Marines or whatever. If I think that most of us white guys, probably the first time we met an Indian was in the military. It's because that was what they could do, and it's devastating to anybody to join. You're not going to come back with a healthy head after that. Anyway, thank you. Thank
All
you.
right. All right. Any comments with regard to what Denny just said, or we'll go right to David Cooley and he'll have his comment and we'll go home. All right, David.
If any of you are thinking about writing op-eds or letters to the editor, things of that like that, there are all the kinds of things that Russell and Suzanne talk about that will go away normally with the VA disappearing. But there are lots of other things like the VSO travel to bring veterans to the clinics and mental health and medical centers. Those van systems are going to disappear. So how veterans are going to get to their elderly veterans, particularly from outstate areas, are going to get to healthcare, to multiple appointments all over cities or wherever they might possibly be, or even specialty care that won't even exist anymore is going to be gone. Another thing that's going to be gone is when you go to the VA, you enter a community, not just of veterans going there as patients. You go there, veterans as part of your providers. You go there with people who have dedicated their lives to perhaps not making quite as much money to care for veterans because they feel it's important. It's a real community. If you can't feel it, you're really missing something. Every time I go there, I just tell everybody, I love you. You are my heroes. We have to take care of one another, is what I say.
Thanks,
And
David.
thanks.
That's awesome. All right. So the way this is going to work is Ken did put his hand up late, but we're going to take it, and then we're going to give our three panelists, Bruce Carruthers, Russell Lenle, and Suzanne Gordon, some last words, and we'll say good night.
Phil has not spoken yet.
Who?
Phil Jocelyn.
Does he have his hand up?
Yeah, and Ken spoke already. So
Okay. Well, Ken, you can go, and then Phil, and that will be it.
Phil, go first.
Phil, I think he said go first.
Okay. I mean, it's just a quick question. I know the veteran service organizations, have done very little thus far. However, they're huge, right? Is there any way to reach them to try to organize them to get involved with any of this stuff?
I think that you should go to them at the local level because people have said that at the local level, if you go to the Legion or the DAV or the VFW, at the local level, you can make more headway than at the national level. And forgive me for having forgotten to say that. So I think that that's a really good question and a good strategy. And I just wanted to say that we're preparing at BHPI a list of all the things that will disappear. I mean, obviously, we can't put everything in there because it would be a phone book. But, some of the things like what David Cooley mentioned, the things that would disappear if VA would disappear. And Bruce and everybody at VAP will get that the minute we're finished with it, which should be shortly.
Thanks.
Thank you. All right. All right. Thanks, Phil. And now, Ken.
I just put it up on chat. Rose Roach from AFL-CIO. She works on single payer, and she's interested in working with VFP and other groups. She made a presentation to our labor working group, and she's fantastic. So I put her email address up there, and she's out of Minnesota, and she's interested in working on saving our VA.
Oh, that's helpful. That's
Is
excellent.
Jeff Roy still on? Jeff, are you still on? Hello? Oh,
I made a copy of her email address, and so I don't know if Jeff's on or not, but we'll make
right.
contact with her.
Okay. Anyway,
Okay. So, Suzanne, some last words?
I just think this is a great thing to be doing. I think we should be continuing to do this and just keeping, you know, batting off the shit they throw at the wall because they're like schoolyard bullies and they collapse when there's enough pushback. I just learned, I'm sure you all know about it, that they took the website of the Black Congressional, the Pentagon Medal of Honor, winners or whatever, and people had a shit fit and then they put it back up, etc. So, and I would really, really encourage you to contact your Congress people, even if they're Dems. Some of the Democrats that I've talked to, the Democratic staff members are demoralized, and it's like, oh, they don't tell us anything, and we can't do anything, and we can't reach anybody, blah blah blah. And I think that we can't reach the Republicans, and I think in this instance, part of the Democratic opposition, we have to reinforce their spines because in this case, preaching to the choir is very important because the choir, you don't want the choir to be so demoralized that they don't come to the church to sing. And you need to give the choir new material, and you need to get more people in the choir. So don't hesitate to contact your Democratic representatives as well as harass like hell, the Republicans. So I just think this is a great group. I think Veterans for Peace deserves such a huge shout out because they have been there before anybody. The Save Our VA campaign, really, you are heroes, right? And so I'm excited to be on here. I know that we would be anything we can do. If you want trainings, if you want whatever you want, we're available to you. And you keep us going.
That's wonderful, Suzanne. Thank you. All right. Russell.
Suzanne covered it all. We're grateful to have the opportunity to spend this time with you to share kind of those things that we have learned in our years really researching and investigating. And we're happy to to kind of continue the relationship that we have with you in the various ways to keep feeding the material, the analyses that we do, the investigations we do, um, and to collaborate together. So thank you.
You're welcome. And for those still watching, Denny just put up his copy of Suzanne's book. So there it is.
Thank you.
And now, Bruce, last word, man.
Well, what I want to say is people shouldn't get discouraged too early that it's like a movement in a sense. It's like the civil rights movement or the anti-war movement during Vietnam. It's not exactly the same thing, but there's kind of a groundswell against what the Trump administration is doing, not only to veterans benefits, but potentially to Medicare, to a USAID, to all the programs it has. And so people have to mobilize and not be discouraged. We're not going to defeat this in 2 weeks. It's a long-term project. You need to encourage people to get involved, to attend demonstrations, to contact their congressmen if they're involved in civic organizations, to get the civic organizations to lobby Congress about making these changes, and ask Congress to get a spine. They're supposed to have control of the purse. Ask Congress to have a spine and to stand up to the president. Anyway, I also want to join Russell and Suzanne in thanking you for having us. And we were happy to be able to do this, and we're certainly happy to do it again if there's a call for us to talk to people about the work of VHPI and the Save Our VA campaign.
So with that, good night, everybody. Have a safe evening and peace.